The coronavirus outbreak is just about to cause more harm than had been envisaged in the management of health services across the globe. Just this week, the Indian government banned the export of critical components of medicines as it positions to secure the health of its 1.3 billion people. The ban, in effect, could hurt developing countries, including Kenya, that heavily rely on India for imports of essential drugs. Sam Gituku looks into Kenya's pharmaceutical market and assesses the impact of such bans will have on the healthcare system that depends on imported drugs, most of them from India.
The country's healthcare is not one of the best globally. Even though the biggest struggle appears to be with the health facilities and personnel, medical drugs, a key component of the service, has not been in shortage, even though the cost is arguably high. The drugs market is valued at more than 100 billion shillings in the country, imported products dominating the market at 70%. According to the Pharmacy and Poisons Board, as of 2018, the medicine imports were valued at 93 billion shillings, while Kenya exported drugs to the tune of 16 billion shillings to its neighbors in the region and across different parts of Africa. Of the imports, India is Kenya's main source of drugs, accounting for 37% of the commercial value, but in terms of tonnage imported, the percentage is higher. China follows at 10%, while European Union sells the country 27% worth of drugs. While the country manufactures 30% of drugs locally, the ingredients are sourced from outside the country, majority of them from India and China. And now, India has, in response to the contagious coronavirus, moved to secure its supplies and therefore restricted the export of certain essential drugs and ingredients. India's population is over 1.3 billion people. Some of those banned for export are paracetamol components, essential for the manufacturing of painkillers, some antibiotics critical in treating infections, including those whose symptoms are diarrhea, have been restricted. Others are antiviral formulations. A total of 26 items have been listed for restriction, including vital vitamin formulations, progesterone components, and antifungal drugs components.
Some of these include paracetamol, which is very key for controlling pain and especially fever. They have banned a few antibiotics, especially some antifungals as well. We have progesterone banned, which is mainly used for contraception in contraceptive formulations, which is a major component in the contraceptive formulations.
The Kenya Pharmaceutical Distributors Association has written to the Pharmacy and Poisons Board to assess the impact of India's restrictions. The association's chairman, Dr. Kamamia Wamurisho, wants the board to take stock of essential drugs currently in the country, restrict export of drugs in the market, and begin a process of looking for alternative sources of finished products and ingredients for the local industry.
The other options mainly would be Europe. But the issue with Europe would be the price of medicines to our population. India is able to balance on price to quality for our population. The other thing is that some of the European companies, that could be even the brands themselves, manufacture their medicines in India. So this export not only impacts us as Kenya, it impacts a major part of the world. Because if I am a large multinational manufacturing my paracetamol from India, it means that I will have a problem.
The restriction is likely to cause shortage of drugs in the market and subsequently push up prices. Should Kenya move forth to restrict export of drugs, it will deny the country a critical source of foreign earnings. Given the country's geographical position, the East African region and the Comesa region are top markets for her exports. For a country still hoping to boost her manufacturing sector under the Big Four agenda, the ban may adversely affect drugs manufacturing and consequently complicate the universal health coverage dream of the Big Four agenda. But Health CS Mutahi Kagwe is confident the country has enough supplies, at least for now. The coronavirus pandemic is yet to find a cure, much of treatment focusing on suppressing the symptoms that include fever, whose main response has been paracetamol-laced drugs. The drug restriction has, however, not touched on specialized drugs that treat chronic illnesses. While the impact of trade restrictions by foreign countries on the sale of drugs may not be felt immediately in Kenya, the action the country takes in the coming days will determine the stability of the pharmaceuticals market, but more importantly, the health of millions of Kenyans who depend on the drugs to see a better day. Sam Gituku, Citizen TV, Nairobi.